Jason Derulo, 105.1 The Buzz. It's Starry Mitch and Ted. Look who's here. It's our friend, cosmetic surgeon, Dr. Michael Workman.
Good evening.
So I brought you this list that I wanted to share with you.
Another list?
Yeah, no, this is pertinent to your job for once.
Oh, excellent.
Yeah, the American Society of Plastic Surgeons just released their data from 2015.
Okay.
You probably either know this already or have heard it, but it's pretty interesting. For the first time ever, more than 40% of the breast reductions performed were on men.
Really?
Men had almost 28,000 breast reductions. Women had just about 41,000.
Wow.
Wow, that is surprising.
I know.
Yeah.
Have you ever done a breast reduction on a male?
I have.
Really?
I have.
Is it just liposuction, or is it more involved than that?
Well, it depends how large it is. I think if we're the typical patient for a breast reduction as a male is someone who just doesn't look good in a polo shirt. It just isn't quite themselves. Yeah, and they want to be able to just look good and maybe take their shirt off. And we initially, oftentimes they have a little more breast tissue, so we cut the breast tissue out underneath the nipple, and then we just do liposuction of the whole breast itself.
Moobs.
Moobs, man boobs, absolutely.
Why do they happen, other than just weight gain?
Part of it's weight gain. And
is it hormonal?
Well, part of it is hormonal. Probably 40 to 60% of teenage boys during development develop breasts, and typically they will go away by the time you're 20 to 21.
You're already scarred mentally, though. That's
absolutely. So most of the time it goes away. We usually don't operate until you're 20, 21. But boy, I've seen a lot of young kids that are really socially.
It's tough.
Yeah. Or just social. Rejects basically because of it.
It's really, at least in their own minds or in the criticism or being singled out by other people. Breast augmentations remain the most common surgery. There's almost 30,000 a year performed.
Okay.
And the newest trending plastic surgery, it's so rare in 2000 they weren't even tracked, and there were about 2,500 performed last year, is butt implants. And I want you to explain why you don't feel as a surgeon that's necessarily a great idea.
Right. Well, I think that I just got back from the biggest aesthetic meeting in the world down in Las Vegas.
Ooh. Well.
And there were a lot of presentations on butt augmentation. The problem is there's a relatively high complication rate relative to other procedures. So that you put that implant in and you're sitting on it and it can migrate, it can come to the surface. It's
there
right
goes
down
my butt again.
Yeah, it's down in the butt crack area, so there are more bacteria down there. So, there's a higher risk of complications. Now, one of the things that is getting really popular is fat grafting for the buttocks, especially down in Miami, kind of the J-Lo, look, and they're putting up to a quart.
Oh my gosh.
A quart in each side. There's
Wow.
a guy that does it down there.
It's your own fat, I guess?
Yeah,
Okay.
it's harvesting your own fat, and it's pretty amazing what some of these people look like. So, and they had the best people in the world down there at this meeting, and some people, if you need to kind of get a better shape, you'll put an implant in.
I'm asking for Ted.
Yeah, I know we all are.
Oh, yeah.
We know who's this for.
Yeah, no. I think in general, if you need a better shape, oftentimes we'll put an implant in. If you've got a good shape and just want a bigger buttock, fat grafting is oftentimes better.
I don't know what I would do with a butt. I don't know.
Honestly, it would change everything.
I don't know what that would.
You'd shake that butt.
change
Well, your
the way
pants
I
would stay up.
Shake that healthy butt.
You'd be like the dog that spins around in a circle trying to
right.
grab
Look
its
at
own
it.
tail. Yeah,
Look at it.
constantly trying to look at it.
Yeah.
So you could take fat from part
Anywhere.
of your body
Yep.
where you don't want this fat, and then
Yep.
you could put it on your butt.
Yep.
How does it
And
stay
that-
there?
Yeah, how come it doesn't migrate all around?
Like a
Well, because it's injected into little tunnels, okay? In fact, I'll tell you something. One of the new things they talked about at this meeting was injecting it into the breasts. And what they do for 3 weeks prior to the actual surgery, they put it's a big suction device on your breasts to expand them. And oftentimes you'll go up 1 or 2 cup sizes so that there is more.
Isn't there a pump you use that's similar to
Yeah. But
Oh, sorry. Carol was telling me about it.
No, yeah. It's electric.
And then
Then you have more. You've got the
to
fat.
expand the tissue.
Yeah, and then you're able to take the fat in like 1 millimeter little snippets and put it into these tunnels. And so you put the cannula in, just like liposuction in reverse, put the fat in, and then inject it as you pull the syringe out.
Pretty amazing.
So I have a question for you then, as a doctor that performs body augmentation surgery. Would you say you're like, I'm going to start doing this? You don't just do it on a person. Like, how would you like, if you choose to do that?
Right.
What would be the process of how you got ready to do a good, effective one?
Right. Oftentimes,
You'd go dig up
to a
dead
course,
bodies,
or
wouldn't you?
Yeah. No, you'll spend time with another surgeon who's experienced in it, and there are a lot of books and a lot of meetings you can go to. But I think the best way for a surgeon to learn a new technique that they weren't trained in, or wasn't around when they went
Is
through
to
training.
practice on people that don't care.
Tell volunteer.
Absolutely.
Ted's
Yeah.
in.
Amen. Let's do it.
Is to sort of apprentice or go around with an expert.
Yes. No.
Yeah.
Exactly.
I think you need to get on that. I think
You think so, huh?
Yeah, I think the bad fat goes to the good fat areas is
That's true.
Kind of like what we've been waiting for.
It's kind of the
Yeah.
answer. It's kind of the answer to
Trickle-down
everything.
surgery.
Excellent.
You can find out
Trickle-down
more
surgery.
about what Dr. Michael Workman does, as well as information about all the procedures themselves, before and after pictures. You can schedule to make a consultation. You can do all sorts of things on the doctor's website. It's drmichaelworkman.com. As always, Doc, we're delighted to talk to you.
But don't spend too much time on the website.
Why?
But,
But-
and he worked hard on that.
That
I
was
could see
really
Oh my
bad.
God, you
That was
should
really,
see
really
how
bad.
pleased he is with
I'm
himself,
sorry.
too.
Brilliant.
No, that was mediocre.
Fantastic.
That was very good.
Join the conversation.